In December of 2008, I started to have severe headaches and tried to tough them out for a while, and then when they brought on nausea, I thought, this is not normal. I went to see my general physician and was diagnosed with migraines. Started taking some medication for that, which seemed to provide some relief, but a lot of neck pain. Started seeing a chiropractor, which I'd seen in my younger years when I was playing sports, and got some symptomatic relief there, but nothing really seemed to make much of a difference. But we all get headaches, right? So fast forward to March, Friday, March 13th. I was home from work and I was just very drowsy. My wife, who also works, had asked me to take care of some things. I was having fine, able to understand and was able to move around and everything, but just wasn't able to actually get the things done. And so my wife ended up coming home from work, and I was sitting in my car at the end of the driveway, and she says, "What are you doing?" And I said, "I'm taking Kate to school." Kate's our daughter. She said, "Well, Kate's home from school today because she's sick, and by the way, she's not in the car." So right away my wife thought that something was wrong with me, so she had some things she had to get taken care of, put me to lay down for a little while, and then was going to take me back to the doctor that had diagnosed my migraines. And she said on the way there, I slept most of the way in the car, so she brought me directly to Kennestone Hospital. And apparently they took one look at me and asked a few questions and told her that they're going to take me in for, I believe, a CT. And they came back and said, "Your husband has a tumor." And of course she was in disbelief because I was walking and talking and otherwise seemed to be fine. And they said, not only is it a tumor, but it's very large and it's in a very bad place, and your husband needs to be admitted to the neurological ICU immediately, where they put me on anti-seizure medication, and made arrangements to book for the first available surgery. Diagnosis was a meningioma, and the recommendation was that Dr. Tariq Javed would be the one best to take care of this. One of my wife's colleagues is a neurosurgeon at another fine hospital here in Atlanta, and my wife asked her friend, if this was you or your relative, would you move them to your brother's care, or would you leave them where he is? And he said, Dr. Javed is a fine surgeon. Really it's the skills of the surgeon that matters most in these situations, and that your husband should be receiving excellent care. On St. Patrick's Day of 2009, so just a few days after admittance in the hospital, Dr. Javed did a 5-hour surgery, and I was told after surgery that he'd removed a very large mass. I was told about the size of an orange. But that prognosis was good. It looked like they'd gotten it all out there. The biopsy said it was benign, and a few days later I was sent home for rest and recovery. And here we are 4 years later. I'm symptom-free, no headaches, no nausea, all memories intact. As far as we can all tell, no different than I was before the onset of what apparently was a very slow-growing tumor. No idea how long I had the meningioma, but there weren't any real symptoms. So if anybody's out there having headaches, don't just push them off. If your loved ones, friends, family think you're acting a little strange, listen to them and seek the help from the fine professionals.